Good morning. It's a beautiful day. I'm Dr. Miriam Smith, and I will continue to welcome you on the podcast. I welcome you to the Empower New Nurses show. Our nurses are really, really excited, our new nurses, about this show. And I'm too, and others have told me the same thing. So today I just want to say a big congratulations to those who were successful with their exams and about to hit the workforce. But before hitting the workforce, you definitely have to have some orientation. You have to be onboarded, of course, and then you're going to go through the process. Now, I know prior to coming into the workforce, you actually had some simulation classes. And simulation, what is that? That has to do with imitation of certain processes. Actually, those experiences help you to be able to care for the real patient, the physical patient who is there in the bed or who needs your help. So it's sort of, they have different type of simulation. They have the high definition simulations that actually in the lab, and those simulation, those patients are able to do the cry. For example, you're able to listen to adventitious sounds, you're able to listen to breath sounds, if they're coarse or they're fine or they're rhonchies or crackles in the lungs when there are secretions in the lungs, in the airway, and stuff like that. So it's important to be able to identify with the stethoscope, of course. And sometimes they're so outstanding that you can actually hear the bubbling sounds and all of that without being even put a stethoscope or assessing for breath sounds. You can actually hear. So that's some of the patients, you can hear the IVs with the fluids going in simulation if the area becomes maybe infiltrated or so, and you'll see that. So it's important, but remember, simulation does not take the place of that patient who is physically needs your help. So practicing in the lab is important prior to getting the patient. In my time, we actually we participated in the actual giving of the injection. In my class, we actually had felt what injection was like because our classmates gave us the injection at that time. And that was interesting because we had to feel somewhat what the patient felt like. Some people use oranges to practice we would say the injection process, like giving an injection, an IM, intramuscular injection, and so forth. So that was some of my experiences. But I just want to welcome you, new nurses, and say congratulations, because this noble profession will continue to grow with great people who care for others, who are loving and compassionate, and really have the patients at heart in giving high quality nursing care. At this time, I just want to shout one of my my podcast members of the member of my team, Dr. Derek Burgess. He's a sport doctor, and he has transitioned to a higher level of autonomy and in the workforce. He's a sport doctor, and we're so proud of him. And doctor of color also in orthopedic. I'm not sure, we have so many, but he's one of those outstanding ones. And so I just want to say kudos to him and his success journey in medicine. I also want to say congratulations to all our nurses who have been so supportive to our new nurses. Now, from my experience, I have some tips that I passed on, and I've been passing on to younger nurses. I like to impart knowledge. I'm a lifetime learner. Many of my colleagues and my friends, although I just retired, have said to me repeatedly, you certainly love the books. But the more you study it, the more you learn and you share, it's just interesting, and it's just make you stronger, and I enjoy that. So I'm encouraging some of my young nurses right now, just keep going, the sky is the limit. And so that book that will be coming out is Empower New Nurses, a guide to empower new nurses. It's a guide to empower nurses to deliver high quality nursing care, of course, to all patients. We're a diverse group, and we provide that type of diversity, culturally congruent care to all patients. And so that book will be coming out anytime now, and I look forward to you getting your copy. Yes, you and you and you. That's interesting. So, how can you contact me? Well, by YouTube at Miriam Amanda Smith, Dr. Miriam Amanda Smith. You can contact me also on Facebook. You can contact me on Spotify, Podpal, Apple, Facebook, TikTok, and Instagram. Instagram at Podcastmere. So I look forward to you placing a subscription. You're going to subscribe also with a helpful comment. You have gained a lot, and you'll be passing on. You'll be disseminating some of the information that you have received. Look forward to seeing you. Look forward to hearing from you, and just ring that bell so you'll be notified as soon as new episodes come online. Welcome again, and just share what you've learned. Disseminate what you've learned. Thank you.
I'm going to get you.
Okay. Wow, this is interesting. I'm in the lab. I'm in the lab at this is an outstanding lab. This is state of the art lab. Where we have a patient. This patient has a tracheostomy, that's a hole placed in the trachea for breathing. Is really, he has pumps on, he's IVs, and here we have a pump, and this pump delivered, they call this a smart pump. This is so interesting. The name of it is Alaris pump, PC, and it has different gadgets, and you thread through, you'll have it hooked up to the patient. But what is very interesting about this pump is that it has guardrails, and these guardrails will allow, it's smart in such a way that it will not allow certain the medication to go above or below the dosage, because there's a guard saying no, this is wrong. So in terms of medication error, it shouldn't happen on here. So this is very important. This is a monitor, and this monitor, it would represent, the patient will be hooked up, cardiac monitor. Then you will see different arrhythmia. You will see different waveform and there, showing that the heart, which of the part of the heart is working correctly. If there's any life-threatening dysrhythmias, then that will be identified. But it takes a prudent nurse to pick up, or a nurse who have actually done an EKG course, to be able to pick up the variations. So that's very, very important. Someone called me from a hospital some time ago and said, Miriam, what do you think about XYZ? So I said, I'm not there, but XYZ. But that person knew that I have done this with me, and I teach this with me. And so she was asking me certain questions. So it's so important as a prudent nurse, as you go, once you can advance yourself, you should. So I just want to say congratulations on what I've seen in this lab. This is awesome. And my professor here, outstanding. Thank you.
You're welcome.
Thank you.